Oh, look at you, Eric. I appreciate that.
Good morning.
Good morning. How are you?
I'm okay, how are you?
Well, so what am I supposed to do around the top? Hold on, just looking at this. We need a couple of people around. So we need stories for us to do a resolution form. Okay. Well, if nothing else, I'll do the resolution in his absence. There's Rao. We got, I think it's not the Rao, but something.
Sound check. Brian, can you hear me?
Yeah, we'll unwrap it or something. Okay.
Thank you very much.
How are you?
Oh, we're gonna start on time. We have a quorum on time.
Look at this.
Going all right. How are you? I know, right? We're like, hey, what to do? Well,
No.
do we have any directors remote? We do not. I'd like to call the meeting of the board to order. Will the secretary please call the roll?
Director Curry? Vice Chair Deere? is absent. Director Garza,
Present.
Director Harrington,
Present.
Director Ryder,
Present.
Director Robinson,
Present.
Director Sorrell,
Present.
Director Story, is absent. Director Webster Cross,
Present.
and Chair Taylor.
Present.
You have a quorum.
Thank you. The next regular meeting of the board will be held on Friday, March 22nd at 9 a.m. The first item on today's agenda is employee recognition, which will be reviewed by Dr. Eric Macias.
All right, thank you, Chair Taylor. Good morning, everyone.
Morning.
I know we have a few team members in the room with us today, so as I mention your names or the projects you've worked on, please stand to be recognized. So we'll start with our new hires. Welcome to Adam Weber, Executive Director, Special Operations, Michelle A. King-Robledo, System Director of Patient Access, Kara Beskin, Senior Manager of Policy and Innovation, Anna Lemon, Senior Manager, Physician Revenue Cycle, Jennifer Scafidi, Senior Manager, Physician Revenue Cycle, Lisa Rodriguez, Senior Manager, Physician Revenue Cycle, Jessica Yi Palank, Community Engagement Manager, Behavioral Health, Mohammed Jaffrey, Financial Manager, Clinical Research, Cynthia Walsh, Manager, Clinical Excellence and Performance Improvement, Crystal Kimbrough, Manager of Inpatient Care Coordination, Andrea Crawford, Clinical Manager, Ambulatory Procedure Unit, Jocelyn Williams, House Administrator, Patient Care Services at JTDC, and Amy O'Malley, Nurse Coordinator 2, Emergency Department, Providence. Welcome to everyone. And we also have some promotions, so congratulations to the following people. Irene Marks, our new Associate Chief Quality Officer, Mabel Frias, Associate Director, Communicable Disease Prevention and Control Unit, Jason Applegate, Lead Poisoning Prevention Manager, Gigi Lacoste, Manager of Inpatient Care Coordination, Marciana Bowen, Oncology Nurse Manager, Regina Lopsevic, Nurse Coordinator 2, Emergency Services, and Sonia Mitchell, Nurse Coordinator 2, Patient Care Services, CIRMAC. We have several recognitions here. We are very excited about how the Behavioral Health Summit went last week. It was held on Thursday at the UIC Forum. It was a great discussion around behavioral health opportunities. We had 700 individuals across 300 organizations attend the event. It was very well received. Next slide. We celebrated Black History Month at Providence this past Wednesday. The event focused on the importance of representation in medicine and how we can work collectively to support our youth in pursuing healthcare careers. Again, another great event. Congratulations to the entire CCH team. We were awarded Press Ganey's 2024 High Reliability Horizon Award. The award recognizes healthcare organizations that position safety as an uncompromisable value and are on a journey to methodically deploy high reliability organizing principles and practices in managing operations to prevent adverse events and optimized outcomes. And we were one of only 5 recipients through all of Press Ganey for the 2024 award. So congratulations to the entire team.
Yes.
And I think we have our team here, our Division of Endocrinology. If you guys could stand.
I got in the back.
Again, congratulations. Our endocrinology division was recognized as, by Becker's as being a, quote, great diabetes and endocrinology program. So congratulations again.
Well done. Thank you.
We had an administrative office of Illinois courts report that looked at our care at the JTDC. And through the survey, all of the components met satisfactory compliance, but a special congratulations to the medical and mental health services. They received exceeds AOIC standards. So congratulations to the correctional health team. We have I think we have some of our docs here, but we had 4 of our CCH docs make the top doc list for Chicago Magazine. Dr. Giovingo with ophthalmology, Dr. Marcus with surgery, Dr. Margetto with cardiovascular disease, and Dr. Welbel with infectious disease.
Oh, yeah. Well done.
Congratulations. And we have our January Commitment to Excellence Award winners, Alexandra Soriano, Physician Assistant, Stroger Hospital, Tara Denise Goody, Director of Patient Relations, Stroger Hospital, Angelica Johnson, EVS Stroger, Gina Howard, Clerk at Providence, and Angela Sims Haynes, Executive Assistant Administration. Congratulations to all.
Thank you.
And lastly, congratulations to Gina Masuda Barnett. She's our Deputy Director of Public Health Programs with CCDPH. She was included in the 2024 cohorts with the University of Chicago Civic Leadership Academy based at the Center for Effective Government and the Harris School of Public Policy. So congratulations, Gina. And I think that concludes the report.
Thank you. It's, welcome to all the new employees. Congratulations to all of the winners. I mean, directors, you see the great work and the great staff, and great team, and all the care we're providing. It's good to see. I'd like to welcome next Commissioner Donna Miller, who represents the 6th District of Cook County Board of Commissioners. She is here today to speak to the board and provide an update on an important matter. Commissioner Miller, welcome.
Thank you. Good morning, everyone. Good morning. I'm Cook County Commissioner Donna Miller. First, I want to extend congratulations to all the staff and those awardees. So great job in making us all look great here at Cook County Health. So I'm here today to share some good news with you that happened at NACO. For those of you who might not know, NACO is National Association of Counties, and we were able to put forth a policy resolution at the NACO meeting that just happened a couple weeks ago. It was a resolution for doula and social support services and training. This was unanimously approved at NACO. And this will go on to get approved at the whole body at the NACO committee meeting in July. So as many of you know, I'm preaching to those who already know this data, but in 2021, the U.S. had one of the worst rates of maternal mortality in the country history dating back to 1965. For Black or African American and Hispanic women, the rates are far worse, and Illinois Black women are 6 times more likely to die of a pregnancy-related condition than white women. According to a 2021 report by the American College of Obstetrics and Gynecologists, continuous one-to-one emotional support provided by support personnel such as doula is associated with improved outcomes for women in labor. Doulas can provide individually tailored, culturally appropriate, and patient-centered care and advocacy. However, only about 6% of women who give birth receive doula care. Accordingly, in 2017, the Cochrane Systematic Review of 27 randomized controlled trials, including over 15,000 women in 17 countries, pregnant women who received doula support were 39% less likely to have a cesarean birth and 35% less likely to have a negative birth experience. In addition, the review says among the 3 types of providers of continuous doula, hospital staff, or patient's loved ones, someone in a doula role appears to offer the greatest set of benefits for laboring women. So my NACO resolution urges the federal government and Congress to assist counties by providing funding for increased doula support services, training and certification, support community-based organizations in building and diversifying the doula workforce, increase education and technical assistance to encourage counties and states to implement Medicaid coverage for doulas and sufficient reimbursement rates to ensure expanded access to doula care for Medicaid enrollees, along with the extension of the Medicaid postpartum coverage, and to improve these maternal outcomes for all women and address racial disparities in maternal health, morbidity, and mortality. Last June, as some of you remember, I held a public hearing along with the Health and Hospitals Committee to discuss maternal morbidity and mortality in Cook County, which brought together Cook County Health, the Department of Public Health, and other elected officials working on this issue, and doctors and nurses who have this expertise on the issue. This led me to sponsor an amendment in the 2024 budget, along with Cook County leadership, to secure $1 million to create a doula program at Cook County Health. So thank you for that, and we look forward to improving maternal health outcomes by doulas. It's not the only way to do this, but there are ways of reducing costs associated with maternal morbidity and mortality. And maternal health was actually one of the major topics at NACO, and doulas was called out and as an example of a tool we can use to improve outcomes included, and that was by Secretary Becerra, the Department of HHS. In talks I had on the Hill, we went on the Hill in the White House, and many of the congressional leaders and our our senators. It's a top of mind issue, and they're looking to see how Cook County Health implements this program as one of the largest public health hospitals in systems in the country. So I'm eager to see this robust DUA program here at Cook County Health, and with your leadership and the leadership at Cook County Health and hospitals, I'm confident this program will be a success and one that can be replicated throughout the state and the country. And on another note too, ISACO is the Illinois State Association of County Officials. We've also had meetings with other counties throughout the state of Illinois, so we can have a comprehensive approach on how we can lift up Illinois as a state that has done something to improve our maternal health outcomes. So thank you for letting me address you all here today, and it's great to be here. Thank you.
Thank you.
Thank
We
you.
appreciate it.
Congratulations.
Yeah. As Director Harrington said, congratulations. Thank you for addressing this. This is very, very important. We really appreciate it, and I appreciate all the support you've given to Cook County Health as well. Thank you. The next item is public testimony. As a reminder, written testimony will not be read into the record, but will be included in the official record of this meeting and posted on the website. Madam Secretary, do we have any speakers who have registered to provide in-person or virtual testimony or submitted written testimony?
We do. We have 2 registrations for testimony. The first is from Karen Rugg. And just a reminder to those giving testimony, you have 3 minutes to provide testimony, and when you reach about 2 minutes 30, I'll give you a heads up.
Thank you. Do we have Ms. Rugg?
Ms. Rugg?
Well, I'd like to thank all of you for permitting me, a DuPage County citizen, to come here and speak in front of you. But this is not your problem. This is DuPage and Itasca, Illinois, where I live. I grew up in Itasca, 3 houses down from a 144-bed medical building. I'm not here to complain or say anything bad about the medical building. They're victims. I got a letter from Kwame Raoul. There are a few things that I was addressing. It blackened out the name of the medical building. My husband helped me put these together. We put them in backwards. The last page, I wanted it to be the first page. But Kwame Raoul said, in order for this office to bring enforcement action, there must be a state statute or regulation to be enforced. And that was one thing. The pictures say another thing. And then the last paragraph, it says, you, me, I can contact Illinois Department of Public Health. Then on the back, it says that I could go to DuPage County Water, the commission there, the Water Management Board, Environmental Protection Agency, all kinds of people. You know, when Berwyn and Cicero flooded, I'm sorry, I'm nervous and I'm not a speaker, I'm just a housewife. It was on the news. They said the localities, Berwyn, Cicero, have got to get together. The county has to get together. The state has got to get together. And I've been asking for help for this problem for 8 years at DuPage County. And of course, I think DuPage County says it's not their problem. But when the rain comes down and the snow melts, you get all these. This was supposed to be the last picture. These are employee cars in the parking lot, more employee cars. It butts up against the forest preserve. When I was a child, it was farmland, 300 acres of farmland. DuPage County bought it up to make it a forest preserve. You can see all this is vegetation from the swamp across the street. And when that swamp fills up, it pushes all that into the street. Now, Itasca did put in like a valve. It's a metal pipe valve. And so when the water reaches the level it's supposed to go down George Street. However, they don't maintain that valve, and it gets all clogged up with rotten leaves and tree stumps and squirrels. And so, and now in this picture, you can see they built a roadway. That first line, second line is a bike path. And the water shoots down here, and the water, Itasca has no storm sewer, you know, where you see the piece of metal with the lines where the water goes out. So it just pitches, it goes down, and here's the Forest Preserve, DuPage County. They have $500 million, I think, and it comes down from the drive to get into the park, and then to the bike path, and then it drops down to the cul-de-sac. Now,
Excuse me, Mrs. Ruff?
I'm almost
Sorry
done.
to interrupt you, but your time is almost elapsed.
Okay, thank you. They have to park in mud. They never clean the street. It's a turnaround, but they don't get in there. They have to park in water. This is part, you can see all the masks and stuff. Itasca doesn't feel that you need to clean. You can take DNA prints in the tire tracks. More sludge in the street. This is a picture of the building. It always floods here, and there's a fire. Over here is where it always stagnates. Always. There's always stagnating water there. Here's a couple people. Now here you see the bike path, here you see the roadway. This line is the roadway. And you see this, I believe, is DuPage County Forest Preserve. If you go to Oak Brook, Elmhurst, manicured, beautiful. This is a dump site. I'm gonna try to hurry up, I know I don't belong here. Here's an overview picture of the property. This is the building, this is South Elm. And this is the president of the DuPage County Board of Health. And I've been there about 5 times, they won't do anything. There's more papers where I've tried to reach out to different environmental people and this person and that person, and even Raj Krishnamurthy, he's only 6 miles away from me in Schaumburg. Can't get through these people, they don't do anything. Just don't do anything. I thank you very much. I don't belong here, but I wanted you to see what's going on. DuPage County, I think it used to be the second wealthiest. I think DuPage County now is the wealthiest county in the state of Illinois. And Itasca is a very, very small town, small place. And I thank you for listening to my story.
Thank you.
We appreciate it. Thank you. Thank you. Do you have any others? Okay.
So we might need to come back if that's okay.
That's fine. We do have another public speaker, but they're having technical problems, so we may revisit directives in the future, okay? If they are able to connect. I'd also like to recognize, that Director Story is present. Welcome, Director Story.
Thank you, sir.
Thank you.
Good morning, everyone. Good morning.
Good morning. The next on the agenda are the board and committee reports. The minutes of the December 15th board meeting, which was recessed and reconvened in January 18th, are being presented for your approval Are there any corrections or revisions to be made to the minutes? Hearing none, I'd like to entertain a motion to approve item 4A, the board meeting minutes of December 15th, recessed and reconvened on January 18th, 2024. So moved.
Second.
Thank you. The motion has been made and seconded. Is there any discussion on the motion? All in favor? Aye. All opposed? The ayes have it. The motion carries. Next, Director Curry will now review the Human Resources Committee meeting minutes. Director Curry, thank you.
Thank you. The Human Resources Committee met on Thursday, February 15th at 12 p.m. The next regular meeting of the Human Resources Committee will be held on Thursday, May 9th at 12 p.m. Received a report from the Chief Human Resources Officer, which is included within the minutes, and information on the following subjects were included: fiscal year 2024 metrics, fiscal year 24 Cook County Health HR activity report, HR optimization and digitization, accelerated hiring pilot, the nursing hiring update, organizational and workforce development update. The committee did not go into closed session, so if there are no further questions, the minutes are being presented for consideration at this time.
Thank you. I'd like to entertain a motion to approve item 4B, the February 15th Human Resources Committee meeting minutes. So moved.
Second.
Thank you. The motion has been made and seconded. Is there any discussion on the motion? All in favor?
Aye.
Aye. All opposed? The ayes have it. The motion carries. Next, Director Harrington will now review the Audit and Compliance Committee meeting minutes. Director Harrington.
Thank you. The Audit and Compliance Committee held a meeting on Friday, January 19th at 9 a.m. Our next regular meeting of the Audit Committee is scheduled for Friday, April 19th, 2024 at 9 a.m. During the meeting, Nicole Amro, Chief Corporate Compliance and Privacy Officer, reviewed her reports, which include information on the following subjects: highlights of our FY 2023 metrics, FY 2024 compliance work plan, and 2 annual reports, one from Cook County Health and one from Cook County County Care. The action items include the receipt and filing of those 2 reports, the Cook County Care Compliance Program, FY 2023 annual report, and the Cook County Health System Provider Compliance Program, FY 2023 annual report. The committee did go into closed session to receive closed meeting reports. We'll receive a review of that report in closed session later in the meeting. Because there are no action items associated with closed session, the minutes can be approved at this time.
Thank you. Given that, I'd like to entertain a motion to approve item 4C, the January 19th Audit and Compliance Committee meeting minutes, which include the receiving and filing of the fiscal year 2023 County Care Compliance Program and the CCH System Provider Compliance Program annual reports. Do I have a motion? So moved. Second. Thank you. The motion has been made and seconded. Is there any discussion on the motion? Thank you. All in favor? Aye. All opposed? Thank you. The ayes have it. The motion carries. Next, Director Curry, back to you. We'll now review the Managed Care Committee meeting minutes.
The Managed Care Committee met on Friday, January 19th at 10:30 a.m. The next regular meeting of the Managed Care Committee is scheduled for Friday, April 19th, 2024 at 10:30 a.m. The committee reviewed and discussed the report, which included information on the following subjects: health plan metrics, 2023 successes in the year in review, areas of focus for fiscal year 24, strategic initiatives and priorities, network strategy and telehealth, redetermination, county care assets, specific health benefits for immigrant adults and seniors, and Health Choice Illinois RFP. Mr. Galena is here, and he will review the metrics report.
Thank you. Welcome, Mr. Galena.
Morning, directors.
Good morning.
I'll start with a review of our membership. This data is through, February 5th. We were at a total of 435,000 members within the plan, which is an increase from prior months, which I'll talk about in a couple slides. The next slide shows our market share data. This is still only through November of 2023, so this is not yet incorporating the new additions of the HBIA and HBIS populations. But generally, we've continued to see that we're right around the 32.3% mark, still with the largest market share in Cook County. This shows the overall trends. You can see the impact that redetermination has had on the overall Medicaid managed care market, and we've tracked very closely in alignment with that. Again, this is only through November, so is not picking up the impact of the HBIA and HBIS member additions in January and February. This shows our budgeted projections, which are the blue bars, versus our actuals, which are the red bars here. As you can see, we expected in the budget to see a decline in membership from redetermination. However, for January and February, we're now gaining additional members from the HBIA and HBIS populations transition into managed care, and that is more than offsetting the impact of redetermination. So we've seen month-over-month growth for the past couple months, and we're expecting that will continue into March and April until the transition is complete of that population into managed care, and then we'll see some leveling off of that of our membership starting in May.
Mr. Gleaner, I'm sure the directors know, but the acronyms, some of the public audience may not be aware, because you could.
Yes, so HBIA is Healthy Benefits for Immigrant Adults, and HBIAS is the same, just with seniors.
Thank you.
The next slide shows the impact of redetermination, and apologies if this is a little bit small, but if you look at the blue line there, you can see that the success rate of redetermination within our plan has been ranging between 83 and 86% pretty consistently. The last month of data there is at 86, which is one of our best months to date. So we're continuing to put a lot of effort into our outreach and engagement of members. This is continuing to perform better than we initially expected. We expected retention to be around 80%. I'll also add that we're seeing more than 90% of individuals submit their paperwork back to the state. Some of those, of course, may be ineligible due to income or other changes in status over the past couple of years, but overall, we're seeing very strong results continue here.
Is there a way for us to acknowledge the members that return? I think it would just be nice, since we're at 86%.
Mm-hmm. Yeah, absolutely. This slide gives a summary of our operations metrics. You can see generally performing within our SLAs here. One thing we are watching is on the call center. You can see in the total call volume in the first row that we had a jump up pretty significantly in volume in January. Probably a combination of things. This is impacts of open enrollment that are hitting, plus there's the transition of the HBIA and HBIS members into the plan starting in January. So we did see some dip in the percent of calls answered in 30 seconds. We are working to ensure we've got some additional staffing that's coming on board, which will help ensure that we're managing within those SLAs. But other than that, I think generally seeing pretty good performance here. Next slide shows our inpatient admissions per 1,000. The red bars are prior period, the blue is current period, and then the light blue shading is projected. Generally, we're seeing, continuing to see year over year lower utilization within the plan, which is a good thing. We do expect we may see some reversal of this as redetermination continues to work through. Often healthier members are the least likely to redetermine, so the acuity of the population is likely to increase over time as that wave of redetermination works its way through. The next slide shows our claims payment metrics. You can see we had a jump up at the end of the fiscal year, which is fairly typical for us as there's a rollover of budget systems, which causes some delays in timing of those payments going out, but you can see the trend starting to reverse, and we expect that will drop back down towards that 30-day mark here over the next month. Then the final slide shows the same information, but just provides that breakdown by the aging categories. Again, you can see that jump up happened really in that 30 to 60-day category, which is the area that we'll look to see reversal when we come back to you next month. That should be pretty minimal at that point. And with that, I'm happy to answer any questions.
Aaron, thank you for this, and great to see the trends reversing. I don't see, and I've missed it, but if there's this one-page or a strategy roadmap related to redetermination about what are the actions at a high level, what's the timeline? And I agree with Director Harrington's comment about recognizing those that have decided to come back and being able to stay with the plan.
Yeah, I think we've covered some of that detail around the strategy and the managed care committee. I'm happy to follow up and make sure you get some of those materials as well. But generally, it's the strategy is to try to leverage every touch point we have with a member, and we see that it's not the first engagement with the member that tends to drive action. It's repeated education and engagement during that RED window that really drives that success, and also refining the strategies over time, so ensuring that we're reaching out to members and their preferred language, for example, has a very big difference on how likely they are to engage with us. So we're happy to get you that full detail and answer any questions from there.
Thank you. So it's over the next year that you'll keep up the strategy, and so come next year, will it look different or evolve?
Correct. The initial large wave will go through end of July into August. Will be when kind of the full 1-year cycle is worked through. It'll be a little more steady state after that. But I think we're hoping to continue a lot of that same work going forward. Like, we've built that infrastructure that's easy to leverage. And I'll also note that we're also trying to leverage what we've built around outreach and engagement for RED, and now transition some of that into our work around closing quality of care gaps and some other things based on some of the additional items we've been able to structure.
Great. Yeah. Well, it has implications for the QPS committee, and so that's why I'm also interested in that.
Thank you, Mr. Galena. Are there any other questions?
Yes, I have a question. Looking at your IPOQ admits per 1,000, you made a statement that caught my attention. You said that as the people are healthier, there's a tendency that they do not redetermine. So my question is there an active way to go after them? Because if we look at it from a budgetary standpoint, that's a lost opportunity from revenue.
Yes, absolutely. So a lot of those engagement strategies that we've mentioned, some of those have been targeted towards those populations, which tend to be younger and healthier, for example. So we've done a number of things through community outreach and events that are trying to target those populations, in particular zip codes, for example. And so that there's a number of different strategies that are focused towards those groups that we know are less likely. The other thing I would mention is that on the revenue side, the state is making adjustments in the rates overall for MCOs as they see the total acuity of the Medicaid population changing from redetermination as well. So there is some protection on the revenue side, but certainly we don't want to lose any member just because they're less likely to fill out the paperwork and turn it back in.
Is there an opportunity to maybe work with a community-based organization to help in that process?
Yes, absolutely.
Okay. Thank you.
And one question, do we have any information on those that are failing to meet criteria to continue on county care, or in other words, are continuing to remain uninsured even if they're in part of the redetermination process? Or are you able to capture 100% of those who attempt redetermination?
Yeah, there's some limits to the effectively what we get back when they go through the state eligibility process is whether they, stay with us or stay eligible for Medicaid, or whether they fall off. So there's a little bit of detail where we can tell For example, if they've lost eligibility because they've maybe moved outside of the county, for example, where they're no longer just eligible for county care, but they're still eligible for Medicaid generally. That being said, if they lose coverage because of, let's say, an income change, we just effectively receive a term notice without much additional detail. We do work with individuals through the application process where we're not just reviewing their Medicaid eligibility, but we're also providing them resources to move on to exchanges or other potential programs that they may qualify for coverage for if they're no longer Medicaid eligible.
Okay. Thank you for that, because that'll be an important potential pool of folks that aren't actually meeting criteria, but may still have health needs that are then going uncovered. Thanks.
Any other questions? Hearing no other, questions, I'd like to move for approval of the minutes.
Thank you very much. Thanks, Director Stu. Very cool. Very exciting. I'd like to entertain a motion to approve item 4D, the January 19th Managed Care Committee meeting minutes.
So moved.
Second.
Thank you. The motion has been made and seconded. Is there any discussion on the motion? All in favor? Aye.
Aye.
All opposed? The ayes have it. The motion carries. Next, Director Bott will now review the Quality and Patient Safety Committee meeting minutes.
Thank you, Chair Taylor. The Quality and Patient Safety Committee met on Thursday, February 15th at 10:30 a.m. The committee received the following reports, which are included in the minutes. The Operational Excellence Dashboard, and note there is a request made for future updates to include information on actions being taken and timeline for improvement. Received an update from OPEX Patient Experience Work Group, received an update from the OPEX Throughput Work Group, and received a regulatory and accreditation update. The committee approved the following action items, which are included in the minutes. Approved one Stroger Hospital Division Chair reappointment, approved Stroger and Providence Hospital medical staff appointments, reappointments, and changes. The other point of information I'd like to bring to the board is after our last committee meeting, I met with Dr. Merkitis and Bina and Raji and the quality team to discuss a redesign of the agenda for that committee meeting, to put the action items up front, to create more space and time and dialogue for the discussions around the updates, and so we can get more strategic. We can engage in some of the important conversations around quality and patient safety and the path forward. So we'll be bringing that to the board. There's also a governance enhancement, given the various governance committees at the sites of care, Provident, CCH, and the ambulatory, and will also be, those will roll up to the QPS committee. And then I'd like to engage with the directors on strategic issues around quality and patient safety and kind of the next generation strategy, and also think about the use of technology. And I'd like to recognize Commissioner Miller for the comment around doulas, because that has an impact, a material impact on quality and safety. And there's new data emerging around virtual use of doulas and the impact on quality. So I want to bring that to the director's attention. We'll continue to update you, but I'll talk to the directors individually about how we can bring some of those conversations to that committee, and then those that need to happen here can have them. But let me see if Dr. Merkitis, Bina, Raji, any other comments you want to add?
No, I don't think anything to add. That covered our conversation very nicely. I'm very excited about the governance committee structure that's going to be coming into place. Divisional leadership, right? So we'll have Stroger and Provident, ACHN, CIRMAC, having more robust discussions as working groups, including, I think, two directors in each of those committees, which then rolls up to Director Bott's QPS committee. So I'm looking forward to kind of having a tighter thread kind of pull through those discussions. Yeah.
Looking forward to it. And I think the recognitions from earlier today just speak to the priority and the impact of the CCH's team on quality and safety, and particularly the High Reliability Horizon Award. So the next meeting of the committee is Thursday, March 7th. We did not go into closed session. So if there are no other questions on the minutes, they're being presented for the board's consideration at this time.
Hearing none, thank you, Director Bott. I'd now like to entertain a motion to approve item 4E, the February 15th minutes of the Quality and Patient Safety Committee meeting, which includes the approval of one Stroger Hospital Division Chair reappointment and approval of Stroger and Providence Hospital medical staff appointments, reappointments, and changes. Do I have a motion?
I'll make the motion.
Thank you. The motion has been made and seconded. Is there any discussion on the motion? Thank you. All in favor?
Aye.
All opposed? The ayes have it, the motion carries. Thank you. Next, Director Ryder will review the Finance Committee meeting minutes.
Thank you, Mr. Chairman. The Finance Committee met on Thursday, February 15th at 9 a.m. The next meeting of the committee will be held on Thursday, March 7th, 2024 at 10 a.m. The committee considered the following action items, which are included in the minutes. We conditionally approved 31 contract procurement items. Number 3, 4, 5, 6, 11, 12, 16, 17, 26, 29, and 30 are pending review by contract compliance. On the screen, you'll see the contractual requests from the Finance Committee whose fiscal impacts are greater than $1 million, which are highlighted for your information. We received and filed grant award related items. The committee received the following reports, which are also included in the minutes. The MBEWB report, the Q4 fiscal 2023 report of contracts executed under the authority of the CEO, which are contracts under $150,000. Report of 7 emergency purchases, revenue cycle transformation plan, the report of December 2023 financials, quarterly update on the VIA contract, contract management, and nursing registry services. There was a request by Director Harrington that the total sum of the contracts be provided for the report of contracts executed under the authority of the CEO. That information was provided after the meeting and is included as part of the meeting record. With regard to emergency purchase with Alivo Medical Center, Director Harrington also inquired regarding the volume of patients seen at Alivo under that contract. If there are no other, and that's a follow-up item. If there are no other questions, the minutes are being presented for the board's approval at this time.
Thank you. Director Harrington, you satisfied with the follow-up?
Yes.
Thank you. All right. I'd like to entertain a motion to approve item 4F, the February 15th Finance Committee meeting minutes, which contain the following action items: approval of the contracts and procurement items, and receiving and filing of the grant award related items. Do I have a motion?
So moved, Mr. Chairman.
Thank you.
Second.
Thank you. The motion has been made and seconded. Is there any discussion?
Chair Taylor, discussion,
Please,
just
sir.
voting present on contract and procurement items for this session.
Noted.
I don't know if Debbie
On
has any.
all of the
Yeah.
contracts? Okay.
Noted. Thank you. All in favor?
Aye.
All opposed? Thank you. The ayes have it. The motion carries.
Chair Taylor, sorry.
So we do have,
Please record me as also voting present, for the Q4 fiscal year 2023 report for the contracts executed under the authority of the CEO contained item, for the February 15th Finance Committee meeting.
thank you. Madam Secretary, do we know? That's been noted. Thank you, Director. We do not have any contracts being presented directly to the board for consideration, so we'll move on to the next item. The next, yeah. Are we coming back to public testimony? So can we move on? Thank you. Perfect. Fantastic. The next item is a review of the quarterly report of the Cook County Department of Public Health, which will be presented by Dr. Lamar Hasbrook. Hasbrook, welcome.
Good morning to the directors.
Good morning. Good morning.
All right, so Lamar Hasbrook, Chief Operating Officer, Department of Public Health, and we have chosen to highlight our work in promoting vaccinations for this quarterly report. So as usual, we like to frame the problem or the challenge first, and so this slide attempts to do that. You all know that there's been 3 seasonal respiratory illnesses of concern. There's been additional guidance since last flu season around RSV, different tools, additional tools in the toolbox. You may or may not know that the vaccination rates for kindergartners and children have been steadily declining across the state, as much as 10% in some jurisdictions, and is the lowest childhood vaccination coverage in a decade. That's concerning. We actually did have a measles outbreak, and some of the herd immunity rates are needed to be like 95% or better, so this is very significant.
Next slide.
So I'm just a point of clarification, across all vaccinations declining by.
Childhood vaccination, yes,
Childhood vaccination.
yeah. Those coming to school having completed all of their required childhood vaccinations, yes.
Okay, let's ask the basic question, why? We have to ask it.
No, this is.
Want to do questions as we go?
Oh,
I'm happy to.
How, Director, how you want to do it? Which are you comfortable doing? Because that's what's going to happen, so.
As long as you're okay with the time, because we'll take them as we go.
We'll take them as we go.
Okay,
We'll move them along.
Yeah, so a couple of trends we're noticing. So some states, have, ways for folks to opt out, exemptions. And all states have medical exemptions. Some in addition have exemptions for, philosophical reasons or for religious reasons. We actually have all three. And what we find is that the more exemptions you give folks, the more they take them. And so those states who have declining rates are those that tend to have all three of those exemptions, including us. There are some zip codes, some school districts that do better than others. There are some schools who are not as diligent in requiring them. There are private schools, there are charter schools and things like that. So there's a myriad of reasons why, but we've been seeing a disturbing decrease and decline, and that's one of the reasons why we wanted to kind of reamp and put this issue front and forward for the public.
Thank you, I think.
Yeah, I have a follow-up question.
Oh,
Really, and it may be a request more than a question. Since there's been this, decline in, seasonal, respiratory, vaccines, are we expected to see an uptick in children at some point, or will we be monitoring to see if there's an uptick?
We are monitoring, the state is monitoring, and we had the first, I'll put it this way, there are hazards, potential hazards, and one of those could be an outbreak or a cluster. We just had a cluster of measles, earlier in the fall, first time, I think, in 8 or 9 years or so. So whenever the herd immunity goes down across all vaccinations or vaccine preventable conditions, yes, there is anticipation that we are at risk for a cluster happening. But we are monitoring both at the state level and locally.
And perhaps there's a need for us to educate the public about the importance of vaccines.
That's exactly what this presentation is about.
The next line.
So that's what we're doing. So here's the solution, expanded messaging. All right. So what we're doing is not just focusing on the so-called triple-demic, which is the COVID and the flu and the RSV, but also all of the vaccine preventable diseases across the lifespan. And so our campaign actually has different panels for each target group. So we're focusing on the general audience. You see the triple emphasis there, parents of pre-K, K to 12, pregnant moms, and you'll see the bubbles are different in terms of the vaccines that are required and that are needed. And then, of course, seniors who are at risk for things like shingles in addition to RSV, et cetera. So want to make sure folks know that there are vaccine preventable and vaccine modifiable conditions that everybody should be mindful of. And of course, CDC has these vaccine tables that we've been sharing with the public as a part of this campaign, which I'll share with you as we go forward. So that's part of the solution. Next slide. So our approach is back to school events and an awareness campaign. There are primary targets, again, those different groups across the lifespan. The geography, obviously our jurisdiction is focused on suburban Cook, but we do reach the entire metro area and entire Cook County. We focus and hone in on those 30 priority zip codes based on the CDC Social Vulnerability Index. So a lot of our hyper-local focus has gone there. Using multi-channels, as you can see, and the price tag for this is grant funded is $320,000, and I'll tell you a little bit about that as we go forward. Next slide. This slide, everybody wants to know who are the target priorities, who are those communities. This slide shows exactly that. You can see the drop pins as to where they're at in our jurisdiction and the names of these priority zip codes. Next slide. So community event, it is important as we build healthier communities to get out in the community directly. And so we did a series of back-to-school immunization awareness events from August through, I think, early October. And the next few slides are just going to highlight the vibrance of those. This one here was AKA a homecoming event. AKA, for those who don't know, is a Greek sorority, Alpha Kappa Alpha. I think we have a member here, Commissioner Miller. And so they did a homecoming event in late August. We were there.
This focus obviously was for African American. We engaged the African American audience there. Again, we focused on giving them the information in a very friendly way, and also making sure we can enhance some health-related behaviors and activities. So we did, exercise classes and Zoom and things like that, fun activities, back-to-school goodies for folks, and then make sure the parents and the adults got the CDC vaccination schedules. Again, trying to be interactive and make it fun, but also make the point. Next slide. This event actually had 700 folks there, and you can read through the details at your leisure, but there's some also important quotes down at the bottom. One, I like to emphasize, that don't have any small children, but have grandkids, and this is great information for them. So multi-generational approach in the community, again, meeting people where they are. Next slide. Also went to Robin's Parade event. This was in early September. Again, an African-American focus. There you can see the location of this. And again, everybody got the same thing, but it took on a different flavor for the different community members in terms of the, the folks that were there. Next slide. 400 folks were at that particular event. And again, a quote from a resident there. The schedule was so helpful. Again, the picture in the bottom right-hand corner is the actual vaccination schedule. It's kind of age-phased, and many of us are familiar with those, but a lot of the community are not familiar with those. So again, trying to emphasize there are vaccinations needed across the lifespan, and you need to be aware of them, and you need to know that if you avail yourself of them, you can actually prevent or alter outcomes from some of these infections. Next slide. So we went to Wolf Flea Market event, and this had, we engaged with the Latinx audience there. Again, everybody got the same goodies. There, next slide. 2,000 folks were at that event. And again, a number of the quotes that I'd like to highlight. We're the Cook County clinics that offer free shots. So again, being that referral piece out in the community and directing them to resources. If I don't have medical coverage, where can I go to get vaccinated? Again, another opportunity for teaching and connecting them with resources. And does CCDPH have the new vaccine? So there's some interest. Again, putting it front of mind for folks and helping them understand that these are important considerations for the health of you and your family. Next slide. And then lastly, our fourth event was the Blue Cap Farmers Market event. Also had a target audience, largely Latinx audience. And you can see some of the photos here. Some of the things that we had in the bag. You can see the health-related stuff, Clorox wipes, et cetera, COVID tests, et cetera. Getting the information out into the community, and then having the time to talk with them and answer questions for them. Next slide. I think this one had about 300 folks who were at this event as well, and you'll see again some quotes. So just want to give this board kind of an insight into the vibrancy of what we do in building healthier communities for our jurisdiction. Next slide. Oh, yes, there's a
Yes, Dr. Hasbro, this is wonderful, and I probably need to pull myself out the weeds, but I know you had a great turnout at one of the flea markets. Over 2,000 folks attended, but only 350 boost bags are given out. That seems to be the number available. Was there an opportunity to have more boost bags if the intent is to have more of those given out, or am I misreading that?
Yeah, well, what we do is, based on the foot traffic that comes to us, it is an event with a lot of vendors and a lot of things. Like many events, you don't go to every single booth or every single area. So we're there, but what we like to do is make connections there and exchange information so that we have representatives from other CBOs and other FBOs, et cetera, that can then link with us afterwards. So these are just the numbers that happen on that day in that time period.
Yes, thank you.
You're welcome. Next slide. So this slide really summarizes the 4 events, over 2,400 folks. And again, some of the goodies that we gave out. And most importantly, that last column, 1,400 vaccination schedules distributed. So again, these are very important aids for families to have. Next slide. So then we had a paid media campaign, so that's being in the community. Then we did some things on all of the different outlets, so social media outlets. Again, those community events cost about $10,000. Remember, this whole campaign was $320. The other $310 went to get the message out through the campaign. So what we call Boost Up Cook County, you've heard about that. So we're just kind of extending on this. And so we paid for had a total of 36, nearly 37 million impressions through this. through social media and a number of other, methods that I'll talk to you about, shortly. TikTok performed the best, and all the rates were above the industry benchmarks. Next slide. So again, these are not static ads, as I showed you before. These are actually dynamic ads. So the bubbles come up over time and they're moving kind of in motion on these different social media platforms. And again, we hit Facebook, Instagram, TikTok, Snapchat, and all the rest. And then we did some things through broadcast radio as well. Next slide. So I believe the next slide highlights. Yes. So both Spanish-speaking Univision stations and then iHeart stations. So we're very present on them. Just want to direct your attention to the bottom of each of these in terms of the ROI question. So again, we want to be fiscally responsible. Even though this was grant money, we want to make sure we get the most out of it. So we purchased, for instance, for iHeart stations, $2 million impressions, and we got 2.3 million impressions that were delivered. So that's a positive ROI. Also in Univision stations, rather, we purchased 1.8 million impressions. We got 2.3 million impressions. So again, getting the information out there in the way that folks receive information and prefer to receive information. Next slide. So we also did the bus ads, the Kings and Queens, which are those large and medium-sized ads that you see riding through the buses, making sure, again, making the information easy and digestible or digestible for folks to get. Next slide. And this kind of shows the territory of where those buses were. And again, focusing hyper-local in our jurisdiction, but also touching the larger Cook County metro area as well. Next slide. We also did newspaper, so print media as well. Again, here you see side by side the total circulation of the Lawndale, which is 240,000. We did a couple ads there, and then also in the Citizen, Lawndale being a Hispanic, like Latinx audience, and the Citizen really focusing on targeting African Americans. Again, you see the total circulation of that publication, 160,000. So again, we're hitting them in social media platforms, broadcast, digital, out of home, and all the different ways that they might want to consume this information. Next slide. So now we talk about kind of the earned media. It's the free stuff that we get by folks just kind of coming to us as a source of expertise on this, and whenever there's concerns, such as the measles outbreak, et cetera. So we had some 30 placements across print, digital, and broadcast media that were free to us. It resulted in about 13 million impressions. And you'll see the breakdown of those with about 2 million through radio, 10 million through digital placements, and then some change through print media. Next. And then, of course, coming to us as a department, me often, or my other subject matter experts, to talk about what's going on in this area of vaccine-preventable diseases, the triple-demic, the measles outbreak, and the like, and making sure we take all of those opportunities to demonstrate the importance of the Boost Up Cook County campaign and the spectrum of vaccine-preventable diseases, not just, again, flu and RSV and COVID, but all the other things that are very important as well. And then the call to action is to send them right to the Boost Up Cook County page, where there's a lot of resources on all vaccine-preventable things, even Mpox and other things, and digital things that they can use to embed, or communities can use to embed in their own personal or organizational social media. And then the last prong of this solution-oriented approach was vaccination clinics. And so we've given the information, we've also given the vaccination. So we have tomorrow our last of the 10 vaccination clinics that we've done in partnership with the ACHN on Saturdays out into the community, where we've done about 50 or 60 vaccinations each of these. So we're up to about maybe 500 or so, heading towards 600. Not as many as we wanted, but for those 600, it can make a real big difference. And so it's an opportunity for our public health nurses to get out into the field, to meet the community, and to partner in doing vaccinations. And again, it's an opportunity to give them additional information about some of these vaccine-preventable conditions. And with that, I'm open to take any questions. Thank you.
For just a question. I know we focused on this triple threat here, the COVID, the flu, RSV. I've heard more this year than I probably ever have in a long time about HPV and the age at which those vaccinations can occur earlier on. Is that something that we're keeping our eye on, or does it have a role in this?
It is one of our bubbles for that particular audience, usually young adults, and usually when they get into their teen years, they're eligible for that. Yeah. So it's to prevent HPV, which can lead to cervical cancer. It's a 3-shot series, typically, sometimes a 2-shot series wherever you are. So we give that general information, and then we direct them to, kind of the resources in terms of those age-related schedules and guidelines schedules. Yeah. So it's a part of it, but it's not an end. It's not. Yeah.
How are we able to, attach the vaccinations to the annual physical for school? I have kids. Every year we have to take our kids. It's required by the school. And is there any mechanism to enforce the schools to do what they're supposed to do? Because it's important, as you noted, 10%, that's a large number. And it's basically, we're regressing. So I'm looking at the mechanisms that we can utilize to actually improve. And I'm under the assumption, and let me know if I'm wrong, that when I look at the slides, are we talking about younger parents? Because I'm just thinking about the idea of vaccinations. It was not a thought for me growing up as a kid. And for my children, it was not a thought. It's something you do. I'm trying to understand, why do we see this change? I could think it could be the political rhetoric that we hear about vaccinations, but I don't know.
Yeah, that's a good question. Well, first of all, in terms of the regulatory, that's really ISPE, the Illinois State Board of Education. So they bake this into what's required. And then in terms of the implementation of that, or the execution of that, that happens at a district to district level and a school to school level. So how vigilant are the folks who are regulating this, ensuring that the parents are actually doing it, and then how vigilant are they in keeping the kids out of school who don't have the appropriate vaccination? So that really comes down to, from the state level to a very micro, hyper-local level in terms of implementation. What we've seen in our research is that it varies. There's some school districts that keep this 95, 96% level of vaccination, therefore having that, inferring that herd immunity and protecting their herd or their school. And then some we've seen as low as 55%. Compliance, and so it varies. All over the map. Your second part of your question was?
I'm sorry, your numbers with 55 really threw me for a loop.
Yeah, and we have some detail in where some of these, because we've done a lot of press about it, where some of the hot spots are in terms of some of the kids not doing it. But I think you asked about kind of the caregiver or the parent age.
Yeah.
We don't typically collect that information. What we do know is that it's fairly easy to have a philosophical objection to it. I just don't believe in vaccination, and that's an exemption that you can get. Even some of the medical exemptions aren't necessarily, medical. Again, it's your relationship with your doctor and how you negotiate. My kid had kind of a adverse reaction last time, kind of a rash of vaccination, and so it happens on that level. And then of course the religious exemption is there as well. So again, the more opt-out options folks have, we see that the more they tend to take.
Two more questions. Can you speak to some of the districts, not necessarily you, but the Organization of Public Health, go around to educate them on the importance of it? And secondly, is it possible to team up with some of the clinics like Access, Aunt Martha's, to be able to try to create a big buzz around vaccinations to get parents and kids in there to get the shots?
Well, in the latter part, we have this website, boostupcookcounty.com, and all of our aids are there. The schedules and all the social media graphics, not just the ones I showed you, but ones earlier in the campaign as well. So a step for any community partner, or any healthcare facility, or any critical access hospital, or any FQHC could be to go and repurpose those things. In terms of talking with the schools, yes, we have a cadence of talking with the schools, meeting with all the schools in suburban jurisdiction. There's a lot of them. We typically have about 100 schools on each call. We used to do it every other week, every 2 weeks, twice a month. Now we do it monthly. And they create that agenda. And one of the things that's been on that agenda repeatedly, actually through the fall season, has been this very issue. So again, we're pushing the information out to them, answering their questions, and those are Zoom calls, and those tend to be about, usually about an hour and a half or 2 hours, and can cover a breadth of different public health topics, this being one of them.
Last thing, can you, have field nurses go out and perform vaccinations in the school if the school has given prior authorization for their child to be vaccinated?
We probably do not have the capacity to do that with our nurses. Our nurses have stepped up to do these 10 clinics that I just shared with you, and they're doing it on Saturdays. They're doing it, on their own time. We're doing it, in collaboration with ACHNs, et cetera. But we don't have the nursing staff, the public health nursing staff, to do that on demand. That said, we can work with our schools and some of our districts who might have a need for that and a request for that to fashion something specifically for them.
Thank you.
You're welcome.
Let me reassure my colleague that Aunt Martha's is involved in that excitement. Can't speak for anybody else, but yeah. Dr. Hasler, I just want to say that I feel, the feedback I get from my staff is that we feel the county's presence, public health presence. So it's a great partnership, and we appreciate everything you're doing, and it's nice to see the visibility of what efforts that are going towards really trying to engage the community in all this important work. So thank you.
Thank you. It's really great to hear.
We have a number, Director Bott and Director, all three, Director Bott, Harrington Story, just another one. How we doing?
I was curious about the, if you're seeing much misinformation, disinformation in the districts and the schools, and how this campaign, or other work would address some of that.
Great question. I would say that anecdotally, we're not seeing it. We haven't been actually asking for it and asking why at the local level, what the impression of those school nurses or the school health officials might be as to even their process of ensuring that they have it. So I think this is a great platform to do that, having this measles outbreak, a very infectious disease, and looking at statewide trends in terms of folks who are opting out, and kind of setting the table. So I think we have a great opportunity to get that information. We haven't pursued it to this point. That's a great point, though.
Well, the first thing I want to do is commend you and your team on an excellent job of taking a proactive approach to a disturbing trend. I think we're all concerned about what you reported in terms of the lack of people getting their children immunized moving forward. So we're all concerned about that. But since this is a grant, I assume the metrics associated with the grant, and you present a lot of numbers, but it'd be interesting to see the degree to which we achieve those metrics. We don't have to see it now, but it'd be interesting to see what the metrics were and the degree to which we achieved those metrics. It also, and one of those is this Boost Up campaign, the Boost Up website. And so one would be how many people actually visited that site. So that would be an example of a metric that we could look at and see, based upon this campaign, we had so many people that actually clicked on or used that site. The last thing, and I assume that all this is targeted increasing the number of young people and people in general that get some kind of vaccination. And the question would be sort of long-term, is there any correlation to any of this activity, or can we show a correlation to this activity, to any uptick, particularly in the areas where we had a program, any uptick in vaccine?
Yeah, those are both great questions and observations. Yeah, we do have a lot of metrics. This is largely a marketing campaign, marketing and awareness and education campaign. So most of our metrics, and I don't want to get too much of the details because it gets to be very marketing-ish. Start talking about click-through rates and that kind of stuff, and impressions and all the rest. So we do have those things. We can easily look at the traffic to our Boost Up Cook County website or microsite, and that's taken on various different iterations. This last one happens to be all vaccine preventable disease, but we did other themes as well, so we can certainly look into that and provide that. In terms of how it moves the needle, in terms of actually action, which is why we had an action piece here too, getting our nurses out to actually put shots in arms. First of all, it's very difficult to attribute what we're doing to that. Secondly, a lot of those effects are delayed or lag behind. And then thirdly, it's a seasonal campaign and a seasonal health issue. So it's really hard to really see. What we can do is concurrently track the vaccination rates overall in our jurisdiction, and then note where we've done the campaign or where we've been active out in market with the campaign. And maybe there's a correlation, and maybe there isn't. But I would posit that as long as we're getting more information out to the community, they're consuming it, they're taking these vaccine schedules, we're working with the schools, every month now. We keep this kind of front and center on the agenda and start mining some of the questions that, Director Bott was saying about what's the misinformation, what's the disconnect, and then look at our statewide and jurisdictional-wide exemption rates. There may be more and more education that we can do.
Thank you. Thank you. And we'd like to see that data.
Okay? We'll get it for you.
Dr. Asper, I have like a two-part question going back to the question Director Robinson regarding the staffing. Is it the lack of resources available to you in terms of hiring nursing, or is it because it's not a part of your portfolio of work that you do today in public health? And I've referenced this to my own experience as a child when the role of public health nurses obviously was much different then. So if you could just update me, the other members of the board of directors, relative to the scope of work relative to the Department of Public Health, and particularly the roles of public health nurses. Is that appropriate today?
Yeah, so what I will say is that the public health nurse is different than the clinical nurse, so that's number one. And the public health nurse typically, and the role of the public health nurse, to your point, has morphed over the years, as most local health departments have gotten out of direct health care. We used to do dental clinics and WIC clinics and all kind of other things. We still do TB, so it differs from jurisdiction to jurisdiction in the local health department. Our core of nurses, public health nurses, tend to focus on case management around directly observed therapy for TB, case management around lead poisoning in homes for kids and stuff, because we get that data from the state. We follow up and case manage those. And then we do things around a program called APORS, which are infants, premature infants, and some of the needs that they may have as they grow up. And we follow those for up to a year or 2 years. Those are typically the core things that we do. Other things that we've done in the past and things we want to get back into is Hep B vaccinations, things around hearing screening, and MCH. And so those are active issues that we'd like to expand our programming, public health nurse programming into. Some of it we've done in the past, but we'd like to go there in the future. And expand the vaccination program or the immunization program, and get our vaccine for children license activated so that we can do kind of more of these things. So if we expand our program offerings, then of course we're going to have to expand our nursing footprint, our public health nursing footprint. So to the question of capacity, right now we have, I want to say, 24 public health nurses. What we know through some of the studies that we've done and some of the studies that this board, I'll be sharing with this board, is that there is a shortage of staff to meet the mission. And so we're going to need more positions for public health nurse to expand our portfolio for public health nursing in the community.
Thank you. I would support the latter going forward, and I hope that my colleagues around this table would also offer or lend their support to you, the Cook County Department of Public Health, in terms of expanding that portfolio of public health nurses.
Thank you.
Dr. any additional questions?
Yeah, I don't have any additional questions. I just want to lead my colleagues in giving you a round of applause and your team a round of applause for the work you've done and the work you will continue to do, and let you know that you have our support.
Thank you.
So, Diego, I'm sorry, I know that sounds like an encore. You have an encore question. So, encore. They're so popular. I want to be sensitive to my colleagues. I think it's time, right? In all seriousness, the importance of the work, right, and the importance of the work we're doing, right? We're building capacity to actually do more work. So I think that's important. Please.
And just one one additional
Oh, sorry,
question.
another question?
Yes, just one
Oh, okay.
additional question. You've had such good success with the, vaccine clinics that you had for COVID, RSV, et cetera. Might it be possible, because one thing that has been noted is once families may miss an opportunity to have their scheduled vaccines, they tend to fall off. And there's some anxiety or shame about coming in. Could it be possible to pair, and then allowing for the capacity to actually pair some catch-up vaccines with your COVID, flu, RSV, so that if someone has missed a shot, that they actually could come and actually have some of their childhood vaccinations as part of those vaccine clinics, and that way you can kind of decrease or minimize some of the shame in getting caught back up, but also have an opportunity to engage folks back into getting back on schedule, and also prevent current outbreaks. I know there's also a measles outbreak right now in Florida that's also sadly running rampant. That allows folks to be able to catch up in less of a demeaning potential way for their follow-up appointments, because then they start missing their primary care appointments too, because they know it's going to come up.
Right, absolutely. That's a great strategy. And in many of these shots, you can get all at the same time, as you know. And so it's no problem catching up and getting your school shot as well. In terms of our willingness to participate and collaborate with that, we're there. In terms of our capacity, obviously we'll have to work with our partners at ACHNs because they have the brick and mortar, and that's what we've been dropping into to do these Saturday clinics. So that is something that we'd be happy to partner with going forward.
Thank you.
Just a comment again. One, I would encourage everybody, which I have, to go to the Boost Up site just for the hit and read the great information that's there. So if we all do that today, we'll pick that up by 40 hits and great information. So I'm going to mark it as well. It's a fantastic site. But I also had a question about two components of the program. One, are we allowed to do at-home vaccinations? Can we visit folks at home for people who can't get to the clinics as a...
So we've done at-home vaccinations with COVID through a partner, through a third-party vendor. We use some of our ARPA money and some of our other CDC money to do that. Our nurses haven't been doing that personally because, again, they have a limited scope and a limited capacity. So we have done that in the past. That's a model, should we have the funding to then be able to do that. The hyper-local clinics that we set up, and then the at-home clinics. So we have done that in the past. And again, we don't have our vaccine for children credential right now, and that's something we're working on as well. So we can have a bigger footprint out in the community and harness these great relationships that we're building with the community as we build.
And we know that there's been incentives, especially around COVID, for gift cards, other incentives for people to get. Do these extend to these types of vaccinations as well, incentives?
They have not historically. I think sometimes there's some incentives with some of the TB programs, directly observed TB, to get folks to, to take their medicine and complete it, because there can be hazards if you don't, if you start and you don't. But we're revisiting the gift card policy, I think, at large, to make sure that we have the protections in place for that.
Thank you.
Here's another question, because you mentioned funding. Is there opportunity to develop a relationship with MCOs? Because they should have a vested interest in those individuals that they're ensuring getting these basic vaccinations. So can you make that connection where you're able to find out what resources they have? Because they have the interest.
Yeah, we're certainly open to cooperating and collaborating with any partner and working out the best model that will accommodate our limited kind of footprint, but also harness our, I would say, superpowered information. So we're open to that.
So you could connect with MCO that may be very close to you.
Yeah.
Okay.
Very close to
That is the picture.
Across the room.
Thanks, again, Dr. Hasbrook, thank you very much.
Thank you, Jimmy.
We'll- Thank you. See, when we like our reports, we get in it. The next item is my report, which is a somewhat sad report, but also very positive. Congratulations. congratulatory, and thankful. We have a resolution in recognition of Director Story, who will be leaving the board at the end of the month, as he will be embarking on a new opportunity outside of county government. I'll ask the secretary to read the resolution for the record.
Proposed resolution recognizes Otis Story, Cook County Health Board of Directors. Whereas Otis Story was appointed by Cook County Board President Tony Preckwinkle and approved by the Cook County Board of Commissioners to serve as a director of Cook County Health and Hospital System Board effective April 24th, 2020. Whereas Director Story has been a valued member of the Cook County Health Board of Directors, bringing extensive expertise in healthcare administration to the health system's governing body. And whereas he has served on several board committees, including Finance, Managed Care, Quality and Patient Safety, as well as the CEO Search Special Committee. And whereas he regularly went above and beyond in attending additional meetings and events in his capacity as a board member. And whereas Director Story provided exemplary leadership to Cook County Health in the midst of the COVID-19 pandemic that strained healthcare providers across the globe. And whereas throughout the pandemic, he was focused on supporting the health system in caring for all and eliminating potential disparities in COVID-19 vaccination distribution and uptake. And whereas he has worked to enhance the collaboration between Cook County Health and Cook County government in his role on the Cook County Health Board of Directors and as Deputy Chief of Staff in the Office of the President. And whereas during this service, he has shown a tremendous dedication to Cook County Health, the residents of Cook County, and the pursuit of health equity. And now, therefore be it resolved that the members of the Cook County Health Board of Directors express their thanks and gratitude to Otis Story for hard work and dedication to Cook County Health and his service to the patients we serve.
Thank you very much. And I will lead off with Director Story, in providing my thanks and gratitude. I mean, and also, quite frankly, my admiration for your dedication to this organization, to the residents of the community. I mean, think about it. You came in at the height, as we said, as the pandemic was going. And I will tell you, you leaned in every detail. You've been a great partner, collaborator, educator for me to learn about this, and appreciated your mentorship. And thank you for all the service and dedication you've given. Really appreciate it.
Thank you, Mr. Chairman.
Well, hold on, they got people to say stuff. They all shy.
I'd like to just add, that I've had the privilege to know, Director Story, for nearly 30 years. Also across the country in the time that he's put in to work for the increase of access to the communities and individuals that were less fortunate than many of us to have the level of quality and the availability in their neighborhoods. So it was a great win for Cook County Health and for the commissioners and for Cook County in general when Mr. Story was recruited and graciously accepted a position here. He has worked tirelessly, and as many of you know, his timing arrived with the great pandemic, and so there was not a lack of work to be done here, and a real conscientious, intentional focus on making improvements during a very difficult time. I'd like to be one of those that would offer that without his contributions, we may not have been as far along as we are today. And when we look at the accomplishments that have been gained and garnered, I'd like to thank Mr. Story for taking the lead, providing the guidance, and sharing with us all of the great things that he's brought to us in this area. We're going to miss him. Hope he doesn't go too far. He'll be a county or two away maybe, but it'd be great to have him still available by phone. Thank you, Otis.
I'd like to add my, admiration, respect, gratitude to Director Story. He's, when I came onto the board, just been a great educator, collaborator, partner, and I would echo Director Curry's comments about just the progress we've been able to make because of your leadership, Mr. Story, and your commitment. And you think about incredible public servants, you put Mr. Story right up there. And someone who cares about the health of this county and commits to it every day. And, we're so grateful and lucky to have had your service, and, appreciate you as a colleague, and thanks for everything you've done.
Yeah, I'd like to add my, I guess, congratulations in a sense on getting a new position, but let him know that we will miss him. We'll miss his expertise, his experience, and his voice at these meetings. I've learned a lot from him. I call him and count him as a friend, and the good thing is I know he's not leaving the great state of Illinois, so he'll be close, and I'm sure we'll be in touch, and he will call me when he has a concern.
Director Story, I guess, I've only known you for about a year since I've been on the board. And, it's been a great year to learn from you. And I will say unequivocally, I'm disappointed that you're leaving. If I could have at least one more year to learn from you, I would have appreciated that. But I'm just a second thought. And everything I understand about you from the year, great person. Not just on the board, but you actually care, which that's something to be emulated, to be able to serve people in the capacity in which you've done. And so for that, I thank you, and thank you for allowing me to learn from you.
Otis, so I learned very quickly that you had a very deep and extensive experience in this industry, and I learned that just by observing the kind of thoughtful questions that you've asked, the actions that you've requested, and the passion that you've illustrated. And you will be missed, but I know where you're going, and we share that geography, so that'll be good to work with you in that way. And yeah, of course, you're the guy that always calls me when you want to go to lunch, so we can always still continue to do that. I'm gonna miss you.
Director Story, again, as one of the newest board members, the mentorship and helping us to not only see the broader aspect for healthcare, but also how to have the compassion, the areas and needs for finance, and to recognize that all of this must happen within a complex system and environment has been just optimal in being able to come in to get a foothold on what's required and to be able to go forward in good leadership. So certainly look forward to being able to continue to learn from that and to echo everyone else's statements so that you'll truly be missed in this role.
And Director Story, I just want to echo that as well too. I only known you for about a year. I wish you were staying longer, but please stay in touch. I see your passion. Thank you for all that you've done and helping me to acclimate to being on a board as well too. Thank you.
I think everyone's gone. Okay. So Director Story, on behalf of the health system, and our leadership team, I just want to say thank you for your availability, your engagement, you know, beyond kind of the guidance and how we operated. There was, I think, an invaluable, you know, input in keeping us engaged with the county team as well, so that we were aligned in what we were doing, and that's greatly appreciated. On a personal note, I just want to say thank you. My short time in this role, you've always been available. You've been a support, and I just can't express how much I appreciate that. I wish you the best of luck.
First and foremost, my honor, I thank God for everything that has happened in my life. So I give always everything I do to the glory of God. That being said, I'd like to express my gratitude for this opportunity to work with the women and men in this room, not just around this table, but the leadership of Cook County Health and Hospital Systems over the 4 years that I've been here to be a part of the service to the citizens of Cook County. I'm grateful for this opportunity I've had to work along beside each and every one of you, regardless of how small or large the task has been. It has been my sincere honor to have had the opportunity to work with each and every one of you. And I will cherish the moments you know, the good and the bad, because I was raised by two wonderful people. My mom and daddy raised me to live by the ethical principle of reciprocity. And I hope that in our time together, I demonstrated that to each and every one of you. If I've fallen short, charge it to my head, not to my heart. I love you all, and I offer my blessings to this institution, which has served people in Cook County for generations and generations to come. Thank you so very much for your kind words. Peace.
Director Story, point of privilege, we'd like to, in a second, present you the token of our appreciation, something to remember us by, you know, as you go through our old county facility professional. We have pictures, you got to stand up, point of privilege, so thank you. And then, actually, I'm gonna do this, I'm gonna do that out of order. I know, point of privilege for the chair. Don't go away. All the directors can come, back up as well. We have, my meeting. Our meeting, we get to do that. All right. Ballot. Thank you, sir. Thank you. Appreciate it. Keep doing it. Once we're all settled, now we get to make it official. All right? I'd like to entertain a motion to approve item 7A, the proposed resolution in recognition of Director Otis L. Story, Senior. Thank you.
So moved.
Second. You for that. Thank you. The motion has been made and seconded. Is there any discussion on the motion? Thank you. All in favor? Aye. All opposed? Thank you. All right, the ayes have it, the motion carries. Thank you, we appreciate it. Again, Director Sturman, thank you. The next item is a report from our interim CEO, which I'm sure there will be a lot of questions.
Well, thank you, Chair Taylor, and good morning once again. We actually have two updates for the group. We're going to start with a report from Vina Peters. We did not have the opportunity to give the nursing update in the quality review, so we're going to give it to directly to the board.
Good morning, Director.
Good morning. Good morning.
Next slide, please. Many of you have seen this slide. You know, nursing, really focus on the priorities of zero harm initiatives to create an efficient and excellent workforce. Also, patient experience, growth and innovation and transformation, and optimization and systemization. So these are part of the health system pillars, but these are specific focus areas for nursing. Next slide, please. Today I'm going to highlight our 2023 accomplishment, and also we'll talk about the current state and where we are going. So this slide is the summary of our acute care nurse-sensitive quality indicators. We started this journey in 2019, 5 years ago. I was new to the system to really improve the nursing-specific quality indicators. Nationally, these indicators are benchmarked through the NDNQI, which is National Database for Nurse-Sensitive Indicators. So proud to share that there are significant improvements we made through improving quality initiatives as seen on this slide. Through integrating high reliability principles, just culture, and also really bringing in the frontline staff to understand and address the gap. So overall, we made close to an 80% improvement in this journey, And these improvements are also created close to over 24.5 million of cost avoidance, because each quality or nurse sensitive or hospital acquired condition has an impact on overall cost of the health system as well as the progression of the patient. So this is so to say, and also to highlight that during COVID, nationally, the nurse-sensitive quality indicators declined around 7 to 8%. And however, at Cook County, this is a combination of the Stroger and Providence outcome, we improved by 15 to 16%. And truly that happened, the commitment from the frontline staff as well as the leaders. Next slide, please. So we continue to focus on our ambulatory efforts. So for the highlight for the ambulatory care nursing is that we implemented a standardized nursing triage process. This is where anyone can call and triage the health services. And we have done more than 400 calls. And truly this is helping our patients to get to the right care at the right time, at the right level of care. In the past, many patients reached our ED to get the basic care, and through this program, the nursing team were able to triage many of the calls to the primary care centers. And also one of the biggest things is to create the staffing plan for the ambulatory to really address the top of the nursing license practice. So we completed the staffing plan for all the clinics across the system. As a pipeline approach, we worked with the many community colleges to establish the MA student placement program here at Cook County across the system, along with the medical assistant preceptor program. Also, we implemented the chronic care management, which actually are going to enhance our access. Also, this is an approved way the CMS reimburses the chronic care management visit by nurses. So it's an early stage. We currently are seeing around 90 per week, and we are also exploring the options of expanding the charge as well as to really bring the access to the front line to our patients. Next slide, please. So again, correctional health and also nursing is, bringing the number of protocols, over 30 protocols really optimize the care at the correctional health system. And I know we talked about public health system with Dr. Lamat. So I wanted to say we also are really looking at the optimization of the workforce of nursing at public health system, really bringing video home visits, as well as we're bringing other healthcare clinicians like LPNs, because there is a national shortage of nurses, so we are looking at the model. In this model, we are using LPNs to do the direct observation of the therapy for the TB management program. We are also integrating community health workers to our airports, which Dr. Hashbrook explained. These are the programs they go and meet the patients in the community with the high-risk population of maternal child health. And basically the community health workers will really bring the resources to the patients, because, some of the maternal health issues are related to the lack of resources as well as the awareness. So we are integrating that. Also, we are bringing the leadership development program specific to public health, so we can really embrace the public health principle and be one of the leaders actually in preventive matters. And also the corrections is establishing the correctional nursing specific quality indicators, because, nationally we always focused on acute care, so we are shifting that to entity level. Next slide, please. It's a high level slide on Providence. There are significant growth at Providence. So basically the census is grown, like almost double for the last 2 years. So nursing is actively working with all the partners to support the growth, as well as bringing other programs to Providence. Next slide, please. Also wanted to say that there's a lot of activities really happened in 2023 to really embrace the workforce of nursing optimization. That includes, we have a nursing residency program that is for transition to practice. This particular program demonstrated an 86% reduction in the early turnover for the new graduate nurses, and we have that here at Cook County. Also, it is very important that we prepare our frontline nurse leaders to manage the challenges faced ahead of us on leadership. So we have a nursing leadership academy program. all our nurse leaders graduated, within that 9-month program. The nursing externship program, we are bringing in the senior year nursing student as an extern, as a pipeline to our, workforce strategy to admit them to the future workforce. Also, a retention initiative, that's what we, hear every day, we talked about. How can we retain the staff? We have a preceptor training program based on the massive recruitment efforts. We train over 200 nurses. We also have a sexually assault nurse training examiners program. This program is funded by HRSA to train nurses to address the gaps across the system. We did the first nursing school summit and excellent progress. We also have nursing excellence awards we implemented. And also our nurses are presenting now nationally to some of the best practices that we saw the changes. Also, our nurse leaders are part of Illinois Nursing Organization's their fellowship program. So lots of activities. Next one, please. This is to highlight our first nursing school summit, and our goal is to increase the nursing student placement. We had our summit in last summer, so compared to the last fall to this coming fall, we actually increased the nursing student placement by 43%. Not only, we also expanded our placement across the system from Stroger. The past majority of them were only at Stroger. Now they are at Stroger, the correctional health system, the ambulatory, as well as the public health system. So this is actually a huge success, and we are planning to do our second annual summit again in this summer. Next slide, please. Again, just to highlight, we have also different level of recognition. DAISY Award is a global recognition for nursing practice, and we have it here. And as I mentioned, also the Nursing Leadership Academy. Next slide, please. And when you look at the lots of effort, the outcome is our nursing turnover. The national turnover is around 22.5, 5%, where ours is 10.5. The recent report demonstrated that 22.5% increased close to 23. However, the Cook County Health System of nursing RN turnover is, declining, 10.5. So this is again the efforts from the whole team. And personally, I meet with all the new grads on a quarterly basis, and we had a huge influx of new nurses join our last quarter. Next slide, please. Again, we actually had quite a bit work behind the scene to manage the nursing workforce, because nursing workforce is one of the largest workforce, and we are also the cost. So significant, structure and built behind the scene to manage the productivity, to manage the position control, the staffing projection, and also to make sure that our staffing plans meet our state of Illinois standards. So this is an example, we have the ability to flex up, flex down to make sure that we are using resources appropriately. And one slide is small, but it shows that sometimes it's not the RN shortage, maybe it's the support staff shortage, so like sitters. So we use this information to really build the staffing structure. The next slide, please. This is an example of also the labor spend. I know I came to the board about our agency spend. So this slide demonstrates that there is a 40% decline in our agency spend since last December. The majority of the declines were related to, we are adjusting the market rate on a biweekly basis. And also we hired, more than 53 net gain RNs, and those are all impacting our significant decline or improvement in our expenditure. Next slide, please.
I'll pause, directors. This has been a point of discussion for a long time. I would like to highlight, thank you, by the way, all of your attention efforts to this.
Very impressive.
Yeah.
Stop.
Well, we're gonna, this is mixed.
Inside the finance committee, when I saw this slide, I lost my mind. I mean, I think I was the only one standing up on the desk, literally screaming and shouting, "Great job!" Because if we look at these numbers, I don't know about here, but any company I've ever been a part of, if I see these numbers, this person becomes a champion. That's just the truth if you look at the numbers. And here's the question I have. Is there a way for having such great leadership here to be able to utilize the savings to be able to pour back into the nursing area? It's just a question, just a question.
I think that's part of the plan, that's part of our overall strategy, right?
Well, I think that's-
a mixed effort.
This came up at,
Yeah.
at finance, and that's the one thing that I would highlight is that we definitely want to decrease our contract labor spend as long as we're keeping up
With our quality
with
of care.
staffing levels, because we still need to increase our staffing levels with new hires. So,
Right.
you know, it's an important part of the story, but until we
Get there.
get there,
It's related. I mean, she highlighted earlier the net staffing gains, and that's the point, to minimize contract and real staff for Cook County. That is the plan, right?
One of the things when I look at this, I'm sorry, I just want to address
Go
what
ahead.
you said. One of the things when I look at these numbers, and Dr. Peters, maybe you can speak to this. When I look at these numbers and I look at the idea of reducing those, agencies, but there's a plus to the agencies, because the census goes up and down.
The flex.
And if she gives us that capability, then there's always that, where's the break point?
Yeah, no, right. I mean, we have to build that in. I think that's part of the plan. Overall, you're exactly right. There's a flex. Sorry, Kalani.
One, just say congratulations, Dr. Peters and your team. This is tremendous, work. You know, you see these numbers and you just, can't help be excited about it. But this other opportunity about where the dollars go, and you and I have, I think, talked about this too. I think there's an important opportunity now because you're not dealing with the acute challenges of the contract costs. It's to, you know, how do you think about upskilling and technology and AI and other tools to actually even drive this further down and have that stability to address the breakpoint issue that was brought up, and then you can plan for it. And because that is where, you know, the future. So I think we need a strategy and action plan related to that. But that would be my point.
Yeah, so if I could, just respond to that, we actually, I'm happy to report, have a whiteboarding session on Tuesday next week, to start talking through what all of those different technological kind of interventions might look like in bolstering our staffing and other, you know, patient engagement, those types of things. So
Yeah.
virtual sitter, virtual nursing, all of those things are on the table.
Yeah, and now you have the time and ability to think about reimagining, the design of work, how teams are structured, how we're gonna, like, that part of this, because you're busy.
And it's actually, we'll hear from Andrea Gibson next, but we're gonna run through some of those strategies. We've kind of done some more work to really hone in on the strategic plan. But it is one of the call-outs within finance. It's one of our strategic initiatives, is to really look at kind of that process improvement, really looking to where we gain those efficiencies, so that it's not just about putting kind of bodies into the process and hiring more people. It's about how do we, you know, become more efficient so we don't need as many bodies, we could repurpose them elsewhere. Telesitter is a good example, right? When you bring PCAs back to the bedside because one person can watch multiple people, right? Instead of one in each room, right? You're kind of providing that, it's more workforce back to the bedside. So.
Curry and Harrington, I know you're gonna have.
Yeah.
I know those.
No, first I'd like to say that those are real numbers here, and it's great to see the direction, but, it can be a little, let's say, I want to choose my words carefully here, because I don't want to take anything away from this improvement. That's a first step, but that's what it is. It's a first step in the right direction, and the comments I hear, they're checking all of the right boxes about what we need to look at.
Right.
But we could miss a wonderful opportunity here now to make sure that the resources, the actual dollars, the actual resources that are being saved are allocated and applied in such a way that the long-term accomplishment of doing this meets the goals that we're setting, and without losing any of the concept we made in terms of the quality aspects and the qualitative environment aspects for our nursing and our patients. So this is a critical piece of this journey right now. And so while I applaud these numbers, it's fantastic work, took a lot of work to get there. We want to make sure that we don't squander this opportunity now for all of these checkpoints that people have mentioned. It's critical that we keep our foot on the gas, keep our eye, stealing the cliche, on that prize, the longer term, and continue to move forward. So thank you for the work that's been done. This is the beginning.
Well
Thank
said.
you.
Well said, Director Curry.
Next slide, please. So, National Association of County, we talked about it. So there's lots of work behind the last 4 years to build a nursing decision support finance structure, the best run through Excel. And those works were presented at the National County Board, and we were recognized as awarded for the best, for the county, board, nationally. So that's a huge kudos to the team who built the structure behind it. Next slide, please. So we started the Nursing Culture of Excellence journey. Many of you heard about Magnet or the Pathway to Excellence. So we are really in the path. And the nurse sensitive quality indicators I shared with the group is really we exceed the mark of being an Magnet hospital. So, and also we are focusing, further focusing on nurse sensitive indicators on few other things which are collaborating with our quality team. Establishing and expanding our national Indian QI, which is National Database for Nurse Quality Indicators, to across the system. And also, we are, in order for us to apply for to start the journey, we need someone from outside to evaluate the current state. We are currently, this week and last week, we started the journey, so more to come on that process. Next slide, please. So then, this is the slide in information. So where are we? This is the, current state across the country on nursing. So if you look at it, nursing turnover, the new nurses are leaving only average length of stay or the tenure is 2 years compared to Cook County Health in the past. Nurses came and they stayed. And also there are significant non-value added to the nursing practice, and which is, that's where an opportunity for technology integration, and also the people are coming into the workforce are looking for more flexibility. 96% of the new nurses, the best thing for them to stay in the health system is flexibility. And also looking at the bedside salary, and also systems are concerned about the reliability on the contract laborers. And the accelerated retirement, many nurses are leaving the bedside, and 100,000 nurses left during COVID. And based on the recent study by American College of Nursing, says that 1 out of 5 nurses are projected to leave the bedside. I mean, I'm not talking about here at Cook County, across the nation. So I think we have to redesign the care delivery model a bit differently through an integration of the technology and embracing the top of the license practice and really looking at some of the tasks. So this is the current state. Next slide, please. So where are we? We are also in the current state. We have quite a bit nursing vacancies. So we have a 41% nursing staff vacancies, and we are depending on our agency and overtime hours to manage that. Of course, there are strategic processes in place to accelerate the hiring process, but this continues to be one of the top challenges for us to get there. So I'm hoping that we can, bring the gap in 2024. Next slide, please. So where are we with the Cook County Health Nurses projection? HR has a risk factor incorporated in the years of service along with the age, and taking all those into consideration, we are projected to have approximately 17% of our nursing workforce to retire. So again, that will add to our vacancy factor. So I think this information can be used strategically to build our workforce for the future. Next slide, please. And also, this is the slide we track, we health equity. Also, workforce equity is very important for us. So we look at the different demographics of our nursing workforce. 51% of them are African American, 12% are Hispanic or the Latino, Latinx, and 25 is Asian, and then 10% is around Caucasian. So we track this, monitor it, and our goal is to increase our Latinx population to meet the population of specific needs. So we are working with HR to look at the job description and other things. Next slide, please. So I want to high level share the future where we are going. So part of the future workforce strategies include for us to really optimize the nursing, workforce, integration of technologies, as well as to really bring in our work-life balance as well as wellness programs to the workforce, along with bringing nursing leadership specific to transformational leadership, because those two are very important for us as we are embarked on our pathway to excellence for magnet journey, because we need to hear the voice of the frontline staff and they need to be part of the solution. And everything we achieve is, through their engagement and input, and we will continue to do that. Next slide, please. Bit short, so this is the slide again, the priorities again continue to be, hiring, the retention, technology integration, and redefining our nursing care delivery model, because even if we wanted to hire, 1,000 nurses next coming few years, it's not out there. So, and also really looking at, do we need an RN license to do some of the tasks? So there's a lot of work will be done to really bring that optimization and integration nursing practice as well as technology. The next slide, please. So this, again, we are really looking at the flexible workforce, part-time positions, and non-traditional shifts, nursing shifts 8 or 12, right? We're talking about maybe a 4-hour shift, 6-hour shift, those are the flexibility people are bringing in to workforce. And also looking at the different role of nursing assistive personnel. Even we talked about maybe a technology assistant, because I didn't do my, my degree in technology, but we are asking them to do lots of technology assisted work, along with establishing a strong nursing informatics structure, and also augment the staffing with the virtual care technology, which Dr. Makaitis talked about, virtual nursing, tele-theater, tele-ICU, and also the documentation optimization. If you look at it, nursing documents close to 400 plus pages, and do we really now, need all those 400 or optimal cases around 214 or 15? So that change is also a part of our priorities. Next slide, please. So we talked about innovative staffing model. One of the big things will be for 2024 is to establish an official shared governance structure that is an integral part of our magnet or pathway to excellence journey, where we will have the staff nurses will be part of decision making. They are now, but we don't have a structure to say we are. So that's going to be our priority. We need to create some leadership position to support the structure, and we have that now in our budget. And APR in practice, we pay for many nurses to go back to school, but we have an opportunity for all of them to be here. So really looking at that practice mentorship program, we have to build the future leaders, so succession planning, as well as an effort to convert our existing agency staff to be a staff, because if we can do that, I think we will probably go a long way. So those are the priorities for 24-25. Next slide, please. So again, with all those things, our goal is to build a high-quality, patient-centered and integrated healthcare system that maximize the resources to ensure the greatest benefits of our patients, community, and the family, really optimizing the nursing practice. With that, let me pause. I think this is the last slide. Yes, thank you. Any questions or comments?
No, thank you. I think, I echo the earlier congratulations to Director Curry. You were timely, right? So if you kind of think about the spot, it's just for directors to double click on something. One, the progress made, that we have to have an integrated approach about this, but just to highlight something, because Director Robinson, I'm sure you saw it. If you look at the current vacancy rate and add to that, assume stagnant, the anticipated retirements, that means we have to replace 50% of the staff. We have to add 50% of the staff. 48 rounding, right? So you talk about the having to have an integrated approach, assuming current state, right? And having a thoughtful approach. So we are on a journey, as you say, and we have to all be coordinated about it. Dr. Harrison, thank you. I was waiting for you.
Well, I just want to build off of some of the comments that were made earlier, because I was going to wait till the end, but since you're getting some kudos, I want to go back to slide number 3. And really, I think that we need to take a look at that, because what I understand from that, and this is dealing with patient safety, clinical excellence, and quality, that there's $24.5 million that we did not spend because of things we avoided. And that needs to be lifted up too, because that means we had more time for patient care and to really focus on keeping people healthy. So I want to commend you for that.
Thank you. Thank you.
Well, can I make a comment? Because I had that page started. Yeah, I had.
Director Bob was next, and then you Director Bob.
Oh, no, I mean, the point, I was gonna come back to this one too, was, great work here. I think the point that I would make would reinforce what Director Curry said is sustainability. And I think not managing to a score or a grade, but how do you actually hardwire these processes and systems so that it's sustainable over the long haul? And so on the QPS committee, that's, part of what we're continuing to talk about. And workforce has an impact on those metrics.
Like, to your point, committees, but they're all integrated, right? We have to all get.
Okay, I'm not gonna say anything about this page that I wanted to because of what you just said. The question I have, and I think maybe we talked about this in human resources, about the different programs that you have that allowed you to make great strides this year, and that they are pilots. And my question was then, and it still is now, it should not remain a pilot. It's proven itself. So if we're gonna continue to put our foot on the gas, we have to figure out how do we really make that become a fundamental part of how we do work here, to make sure that we can fill up that 41%, the vacancy, not to include the retiring nurses included in that number. That's my asterisk.
So while we're having bigger discussions around expansion of that work, the time did run out on the nursing piece. I'm happy to say that we extended, continuing that piece for nursing, so that process is continuing. While we have bigger discussions about, I acknowledge, right, we want to do more outside of nursing as well with the different process. So we're working on that piece as well.
Okay, so I always just get a little edgy when I hear we're continuing versus it's become a standard operating procedure.
No, I agree. Yeah, it's, again, right, we would need to expand to kind of all of the employees, right, to kind of make this is how we do the new process. We're simultaneously working with HR. Again, I mentioned kind of the PI work. We're doing that inside of HR to look at the things we can't control in terms of our process and how we streamline much more efficiently in the onboarding and the hiring process. So, outside of kind of that accelerated process, we're looking to kind of tighten up our processes, beginning to end within HR.
Okay. The other question I have to this page that you have all of your great patient safety, how does this impact the ability to build? That part I don't see on here. I see the funds that we save, but when your numbers go up here, now your rating go up, your star rating should have an impact, yes?
Yes. Nurse sensitive quality improvement, those indicators has direct impact over a LEAPFROG score as well as the CMS star rating. Like an example, the patient has hospital-acquired pressure injury reduction as a big weight in our CMS star rating of 3, and we are actually one of the top 95th percentile performers in the country. So we track it. So this is all kind of connected. However, the question is how building, it's not the building, it's like cost avoidance, right? A patient with a certain hospital-acquired condition will stay longer, and there are studies came out through Institute of Healthcare Improvement, and the particular incident is average cost is set. That's how that calculation is done.
There's also some tied to payment through various programs. For CMS, for example, there's value-based purchasing, there's readmission reduction program. Those all tie directly into, I think there's 5 subsections within VBP. One of them is cost of care, one of them specifically HAIs, hospital-acquired infections. There's safety events, those types of things. So there's all under each of those headings, all of these things fall somewhere. So it does kind of indirectly affect the payment, but it's more of kind of either a quality payment or a clawback if we don't do well. So.
Yeah, so we have two Director Sorrell and Director Cards. Do you have a comment?
Thank you. And once again, congratulations on these numbers. And looking at the priorities and recognizing that even with community college partnerships, that's a start, but how can we go ahead? And this actually came up the other day in the Behavioral Health Summit too, that there might be ways that we can utilize and even advance and encourage at the high school level, because sadly, there's so many percentages, particularly of our underserved groups that are not making it to high school to then be able to benefit from potential partnership programs such as the community college. I'm happy to be able to talk with you to explore how we might look at some high school programs that might include having someone to be able to graduate to become an MA and then start the pipeline, because sadly, we're losing so many people, unfortunately, during those critical high school years, sophomore ages, to even be able to get into a pipeline to help with developing the workforce.
Yes. Happy to discuss that with you, because high school is where we need to capture our future.
Exactly.
Thank you. I'll reach out to you.
So, and if I can share, I'd love to have a bigger discussion as well. And I know you were there at Provident, and I kind of hinted to it in the remarks in kind of moving upstream and engaging younger populations, and kind of you know, encouraging or at least building an awareness that this is an option in terms of career. But we're having very early discussions around looking at, you know, can we engage later, even grade school, 6th, 7th, 8th grade? So that, you know, there's that I Am Able, which played heavily there. We also have Providence Scholarship, right? So there are options kind of later, right? And we need to kind of move upstream. I agree.
And that mentorship role, as well as having persons of color.
Absolutely.
If they don't see people in these roles, then how can they be in these roles?
Yeah. So, some early conversations. Dr. Turner's been instrumental. So we're discussing this. Sorry.
Thank you. Thank you so much, and, all your support, and also I want to take this special moment to thank Dr. Story, and he always talked to me about the practice of nursing. I felt like you, even though you don't have an RN license, you knew the practice of nursing. So thank you so much, all your support, and wish you the best.
Appreciate it. Thank you.
All right, and we did have one more update. Andrea Gibson, as the board requested, we wanted to come back around. We're going to do periodic strategy planning updates so that we're engaging you in those discussions. So, Andrea.
Yeah, good morning, directors.
Good morning.
So I was here, if you recall, in January and reported that as we go into our second year of the strategic plan, we had tried to focus our efforts for the coming year. And we brought the number of strategies we're working on from around 250 to 60. I had flagged we were still trying to work to reduce those, and there was a lot of support from the board in doing that. And I'm here today to report to you on where we ended up on the 27 strategies that we want to use to drive our focus during this year. Next slide. So for each pillar, if you recall, the strategic plan has 7 pillars. The first one is the patient safety, clinical excellence, and quality pillar. And a significant amount of work falls under the first bullet, the continued improvement in quality metrics, which arguably is the most important metric and strategy that we have. We also identified the maintain top quality outcomes for county care members. So both for our patients and our members, we want to have that be a high priority strategy for this year. The other one for patient safety, clinical excellence, and quality is investing in our grant and research infrastructure. So that's the goal of building a transparent, sustainable, and compliant operations within CCH. So relative to the transition that we're going through right now. Next slide. The next pillar is the health equity, community health, and integration. And we have identified 3 strategies here. One is to increase and improve outcomes in targeted areas. We had a lot of different tactics that we had identified in the strategic plan and elsewhere that support this, but it's really, it all falls under this header of access and improving outcomes. The second one is ensuring access to healthcare information. We do a lot of work to make sure language access is available, and we want to build on that this coming year. We also want to advance mobility programs. And then finally, we have some procurement process streamlining and improving MBWD participation. Next slide. For the third pillar, for workforce, we narrowed it to 3 areas. One, increased talent acquisition. Hiring is the number one priority for the Human Resources Department. And then working on reducing turnover, even though our turnover is below national benchmarks, we want to make sure we're retaining staff once they're hired. And we also want to advance performance management and learning programs for our staff. Next slide. For the human experience, we have this broken out into 2 strategies. One related to employee wellness and engagement, and the other for patient satisfaction. as, both are critical components in, supporting this overall, pillar. Next slide. For fiscal resilience, and this was referenced earlier, we want to continue to implement our revenue cycle turnaround plan. As you know, there's been a lot of progress there, and we've got the next phase for this year underway. Reduce reliance on agency and overtime, which we just talked about with nursing, and also driving productivity to align with industry benchmarks. So there's already some work underway under this strategy, but we continue to push on that. Also identified here is streamlining invoice payment processes and looking for process improvements there. Next slide. So the sixth pillar is optimization, systemization, and performance improvement. And this is where we've identified these 4 strategies of expanding value-based care that requires us to do a lot of review of our internal processes and tracking and metrics. And so we're looking forward to rolling that out this year. Modernizing our infrastructure and equipment. We have, plans under capital improvement and capital equipment this year that we want to implement and make sure that we replace end-of-life equipment, for example, and really move forward on some of the needed capital improvements. The third one is maximizing access. So we want to make sure patients can get access to services, and we've identified some tactics that relate to scheduling, a patient portal, providing virtual care, direct booking, aligning the provider plan, so the provider, CCH, and the plan, county care, to get more people into care, and evaluating new care delivery models. We are also doing some work in the surgical space to look at process improvements to reduce cancellations and improve access to surgical services. Next slide. The last pillar is the growth, innovation, and transformation pillar. And this includes a variety of strategies, including developing a referral network with other hospitals and health centers, conducting our long-term programmatic facility planning, including a new facility at Provident. We are working on the continued expansion of subspecialty service lines. And we've been working a lot at Provident with, making sure additional outpatient services are there, and we've certainly been working to grow our inpatient census. Renegotiating and restructuring affiliation agreements. County Care is working to evaluate additional products that would support members throughout their life cycle. And we have a lot of work to do under executing the ARPA-funded projects. That's the federal stimulus dollars that we received as an organization, $170 million, and we have some time constraints to spend those funds, so that's an intense focus this year. Also, very critical is developing the long-term growth plan for CCDPH, which I think there was a lot of progress made over the past 6 to 8 months, but that is also focused under this pillar. And presuming the 1115 waiver that the state has proposed with CMS goes through at some point, we need to be ready for it. And so we want to make sure our systems are in place to be able to hit the ground running if that does get approved. So those are the 27 areas. Happy to answer any questions or receive any comments you may have.
Yeah, I have a question about the American Rescue Plan Act funded projects. And I know there's a limit to time that we have spent. What is it? You said 170 million?
Yes.
How much time do we have to spend that money?
Well, that seems like the goalposts seem to keep moving, but the money has to be spent by the end of 2026. There's a requirement that the funds be obligated by the end of 2024. So, that's where the definition keeps shifting, but generally speaking, we have to have contracts executed, subrecipient agreements in place, before the end of the year, in order to encumber those funds under that program. So this is the critical year.
So if the timing is that critical, the end of this year, it seems as though we should be hearing something about where those funds are going, because time will get away quickly, and there is a lot of bureaucracy within the organization, and we can't afford to just burn money. That's too much money to lose.
Yeah, and we've spent a little under 35 million of it thus far. We've obligated a little bit more than 60 million. So we're on the path, and we have a strategy for each one of the projects. We have about 20 initiatives under that. We've closed out a handful of projects. We had a vaccine incentives for county care members, for CCDPH community events and ACHN health centers. Those, we've expended the dollars completely. So we know what we need to do in each of the areas, and now we just have to finish executing on that.
Yeah. So I guess my question is more akin to, what is the timeline that you would plan to execute on, and then tell us where that money is going to be, so that you meet your deadline? That's my concern.
Yeah, I mean, we can come back with the detail on each of the programs and where they are. We have to obligate all the funds by the end of this year. So by May, the county wants us to have a very clear picture of if we're going to meet that deadline, because some of the funds we might decide together to shift those to another CCH project where we can spend the funds this year, or obligate them this year.
So maybe April or May, we could come back with a more detailed plan with the next strategic update as well. And we can do a deep dive there. Sorry. Yeah, go
I was just gonna ask, Andrew, for those listening to you very carefully as you choose your words here. If I had to ask today what your confidence is that 100% of these funds will be obligated after either you're shifting, you're moving, and the change, restructuring, how high a level of confidence do you have?
It's a high level of confidence. However, the caveat is, I think we've identified several Plan Bs.
Okay.
So if our original plan isn't working, where would we shift the funds? So, and a great example is the Behavioral Health Impact Fund. So if we identify that we're not going to be able to spend funds, we could shift them to a fund like that, and be able to get those funds out and obligated this year.
So it sounds to me that there may be some areas already that have been, you know where I'm going with that, that have been identified as what I call dead money there, that you have to look at an alternative plan.
Yeah.
for
Yeah.
obligating.
That's fair.
Okay.
One of the questions I had looking at all the 27 strategies, I like streamlining and focusing, is, I don't see any related to county care, but I assume or suspect that they're embedded within the existing strategies, and there is the readiness waiver, but specific strategies that we've talked about, and it may have come up in the managed care committee. So I was just curious about that.
Yeah, there's a few, and maybe we didn't always call out county care, but certainly there'll be an impact of the 1115 waiver on county care. But also there's the work on the provider plan alignment. So that's really a collaboration with ACHN and county care to get more people that are impaneled to us into care. We also, in the growth pillar, and I think that one's still up, is they're charged with evaluating, additional products that we might, want to implement in the future. And I'm sure there's, of course, the quality one, which is maintain, the high quality, metrics, for county care.
And thank you. And I would encourage the team to look at ARPA-H opportunities, which are emerging paradigms. The most recent one released around mobile care that's digitally enabled. And there will be others coming, particularly the announcement around women's health yesterday. So just as part of the growth, innovation, transformation set of strategies.
Okay, thank you.
Thank you. For those directors, and some of you are new, but if you think about the work of like starting with the 7 pillars of actually even having that, and then having the specific, we use the term strategies, but you can't have 60 strategies. I call those 60 action and tactics. But Andrew's done the great work of actually continuing to refine and refocus and drive, right, until we know what we're focused on as we go, and we know what we're accountable for, which all of everyone's doing a good job of that. So, thank you.
Okay, I'm just curious. Sorry. Well, with your different pillars, how does it cut across the organization?
Well, that's an interesting question because we often debate what pillar something belongs into.
Right.
It could be quality, it could be equity.
Right.
So it's throughout the organization, and we choose the pillar that we think aligns most with it, although there's a lot of overlap between the pillars. In January, I think we shared how we were rolling it out across the organization. And so we've certainly shared this whittled down list with staff, and we're working through kind of the actual work plans that roll up to each of these strategies. And so we have a pillar leader for each of the pillars, and then we start assigning out the different elements, and, we're working on the operational work right now is developing those work plans.
So,
Does that answer your question, or
if I could,
slightly different?
if I could just add a little bit, sorry. Oh, I was just gonna say, so much like operational excellence that we're doing in quality, it's gonna be very similar structure. We have 4 of the A3s built out already, within the strategic plan by pillar. So as Andrea said, there's a pillar owner, but then within that, those high-level tactics all have an owner. For example, the county care gets a 4 stars under quality is with Aaron. And then the review process that we're putting into place now, we've started with the handful that we've made, those A3s, in reviewing as a senior leadership team at our strategy meeting that happens every other Friday. So we're gonna have at least a monthly cadence where we're going through these A3s, reviewing those tactics and ensuring that we're on track for the things that are due right now, right? We can't do all of those things at once, right? There's gonna be kind of a mapping out through that Gantt chart that's at the right side of the A3 templates. So the things that are due right now will be kind of on that monthly cadence of review to ensure that we're on track, that we as a senior leadership team are all on the same page.
Okay, so yes, you answered my question, and you added more to it. The great way to kill a great strategy is to talk. But you have the different levels then to actually get the operations done, so good job.
Right, there's often a gap between creating a strategic plan and actually implementing it, and it's difficult, right? But I think we have a good game plan, and we did implement a lot last year, and we're looking forward to more good outcomes this year.
Thank you.
Great, thanks.
That concludes your report. Thank you. Thank you. Directors, thank you, Andrew. Great work. Directors, the board will be going into closed session. Action is not expected to be taken.
Mr. Chairman, real quick, before we go into closed session, because I've had to get up probably one too many times today, and I missed the resolution for, Director Story, I believe.
You did, yes.
So I'd just like to record my support for that resolution and thank Otis for all of his time, on this board and his efforts as, Chief of Staff for Healthcare at the county.
Thank you.
Thank you. I'm great.
Appreciate it. So that said, action is not expected to be taken in open session after the discussion at closed session. So I'd like to entertain a motion to go into closed session pursuant to the following exceptions to the Open Meetings Act, 5, ILCS 120-2C, 1 to 11, 12, 17, and 29. Do I have a motion?
So moved.
Second.
Thank you. Thank you. The motion has been made and seconded. Madam Secretary, please take the roll call vote on the motion.
Roll call vote on the motion to go into closed session. Aye or nay, Director Bott?
Aye.
Director Curry?
Aye.
Vice Chair Deere is absent. Director Garza?
Aye.
Director Harrington? Director Ryder?
Aye.
Director Robinson?
Aye.
Director Sorrell? Aye. Director Story? Aye. Director Webster Cross? Aye. And Chair Taylor?
Aye.
You have 10 yeas and 1 absent.
Thank you. The ayes have it, the motion carries. Only keep official personnel, thank you all. Are you trying to take a break? We're gonna try to get through this. All right, very quickly.
I'll be right back.